Hello, everybody. Good afternoon. Thank you so much for joining us for today's webinar, Understanding the Power of Smell, Why Olfaction Matters for Your Loved Ones, co-hosted by Smelling Pink and Family Councils Ontario. My name is Taeyang Zhang. I am the Bilingual Events Manager at FCO. Before we start, I would like to take a moment to recognize the land on which we are gathered today. I am currently in Toronto, which is seated on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Now, a few logistic and housekeeping rules before we turn things over to our guest speaker. You'll notice that currently everybody is in listen-only mode, so we have reserved time at the end for an interactive question and answer period, in which I invite you to use the Q&A box to ask your questions to our guest speaker. And you can use the Q&A box throughout the presentation as well to put your questions in, and we will get to them at the end. And there is also the chat box if you would like to interact within yourselves, if you want to talk to me about anything, or if you have any like technical issues, you can use the chat box for that. And as you may have noticed, this webinar is being recorded. So we like to record most of our webinars and we post them on Family Council's Ontario YouTube channel the week following the webinar. So it will be available next week. So if you would like to share this presentation with somebody who wasn't able to be present today, or if you'd like to view it again, you are more than welcome to. So without further ado, it is my pleasure to introduce today's guest speaker, Tracy Pepe from Smelling Pink. So Tracy Pepe is an accomplished published author, TED speaker, and trained perfumer with a distinguished 35-year career focused on scent and cognitive conditioning. In addition to her professional endeavors, Tracy is deeply involved in the community. She has previously served as a board director for Meals on Wheels and currently volunteers with the organization. Moreover, Tracy holds the position of president at the Canadian Association of Retired Persons for Brampton, highlighting her personal connection and dedication to the senior and retirement communities. Tracy's entrepreneurial spirit shines through her founding of Spelling Pink Inc., an innovative age-tech smell therapy program capturing and analyzing data and its correlation to brain impact, cognitive conditioning, and overall wellness. Smelling Pink effectively targets depression, anxiety, and isolation among seniors. This data not only enhances individual well-being, but also contributes to advancements in AI, paving the way for future research and innovation in mental health care. I am so pleased to pass the mic to Tracy.
Thank you very much. I very much appreciate the introduction. That was a lot for those of you. I have spent a lot of my career focusing on scent. I'm in my studio here in Brampton, Ontario. I have a presentation for you, which I hope to dazzle you. And I also hope to inspire you as a person that would possibly consider it for your nose as a tool that you may have overlooked. I am going to share a personal story that I have just gone through. In August, I got COVID, and it impacted me quite hard, actually. And it impacted my sense of smell. It also impacted my heart, and it's been a long recovery process. And during that recovery process, I was never asked about my intake or my olfaction. I was never asked ever in the health issues about my sense of smell, my sense of taste. And I also was never probed, discussed as a solution to help me feel better. I was quite depressed and sad over the past few months because the recovery with this condition. I ended up in the hospital 3 or 4 times. It impacted my health. And so personally, I'm on the road to recovery, and scent is very much a part of that process. So I also am going to share you the story of my sister who is in long-term care. So we're going to get started. I hope you get excited. If you have questions, I really appreciate it. You would put them in the chat box, and I will leave time to be able to make sure that we talk about this. So I'm just going to share my screen. And we are going to start talking about scent, olfaction. What if scent could impact mental health? What if we just start with that simple question? What would happen if we started to think of it in a different perspective? This is not aromatherapy. This is not perfumery. This is not eau de toilettes or fine fragrances. I am talking about an aroma that you would encounter and what it does to us, the brain, the body, the emotions, and the situation that we're in. You can find these scents in your kitchen and your pantry. There are many herbs, there are many naturals, there are many plants, there's raw materials that you come across on a daily basis, and often we just pass by. And I am trying very much to get people to understand that that engagement in the kitchen when you're cooking, the smell of your child out of the bath, when you're tucking them in, the sheets, how a place feels, the association to those scents. That is what we are really going for, because that is part of the limbic system, the memory component. But then we're going to take it a little further and talk about specific scents that we know have research and that we've been following and working with. And we're in approximately, and I say we, Smelling Pink is working with over 650 long-term care beds within Ontario. We're in the province of British Columbia at this moment in a pilot project, and we're expanding across the country to help long-term care homes address the isolation, the mental health issues that often are affiliated, as well as the associations with some of the illnesses of Alzheimer's, dementia, Parkinson's, and so forth. So why smell? My background is quite extensive. And for 35 years, I focused with some of the largest companies in the world. And I use scent to manipulate consumers to buy things. And I work specifically with their marketing departments, private corporations, to use scent as an influencer. And I know the research, and I'm very much aware of how scent works, and specifically on the brain, consumers, and the behavior. And buying one thing is one type of behavior. But the question came for me during COVID: what happens if I could teach the medical industry to use scent to help behavior and help people feel better? What would that do? And if I could do it in a way that's inexpensive and is just going to incorporate another tool in the toolbox to support individuals. This is my family. This is my son on the right. He's 33 years of age. He is on the spectrum. And as a young child, he always showed a hypersensitivity in sensory aspects. And so we worked with scent. Scent was a tool in our toolbox, raising him along with diet, along with music, along with quiet time, eventually with some medications. There were a variety of tools that we used to help him navigate growing up, his hormonal changes, the body changes, and how did I get him through high school, college, and eventually on his own with a partner. That really was part of a process. And I am fortunate because I have access to a lot of research and materials, and I wanted to share them. This is my sister, Linda. Linda is in long-term care actually at Sienna. And she is part of her home is part of the Ontario Family Council. So it's really great to participate. And Linda uses scent or had used scent. We used it as children. We used to play a game called the scent game. And she has a really amazing sensory. Now, Linda is bipolar schizophrenic, as well as she is in long-term care. And so I always worked with her to help scent. She would come to my store, my studio. She often would participate in events, very intuitive and very engaged in scent as a tool. My TED Talk and one of my books was related to losing your sense of smell and what happens, how do you get it back? And I wrote a book. It's an ebook. It's $2.99. It's not expensive. I designed it to use plants as well as essential oils. So you don't have to buy expensive things, and it will show you the physiotherapy on how to gain your sense of smell back, because there are many people who had COVID-19 in particular, which really impacted olfaction and taste, where how would they know that their sense of smell has even returned? And so all of these things are part of a scientific journey, educational process that I have been on for over 35 years. And so what I want to talk to you about is olfaction and how and why it is so important. Every single day, you smell approximately 10,000 different smells on a daily basis. The scents enter the nose. They hit cilia, which is this blue area. The scents trigger neurons and various synapses and areas in the brain. And then one of the main key components to olfaction, which is very interesting, is it impacts this section, which is where the limbic system is. And the limbic system is home to emotion, feeling, and a lot to do with long-term connections, scent memories. Alzheimer's and dementia usually impacts the frontal part of the brain. And so what we've learned is people can have memories recalled because of scent. It's tricky to find out what scent memory is that in that person if we haven't had that discussion. And that's part of my quest. My part of the quest is, as we are working with individuals with dementia and Alzheimer's, we start having the conversation about, what do you like to smell? What smells are creating that engagement? Because the brain shifts and the brain perception of scent is very different than someone who is not on a sensory spectrum. And so understanding what that is prior is really helpful. And so this is part of the discovery process we're on, but also the education that we teach. Right now, we are really focused on emotional communication, and that emotional communication has a lot to do with many of the individuals that we work with are nonverbal. And many have isolation, separation, depression, anxiety, and they have been separated within the process of the illnesses that they're dealing. This is heartbreaking for the families, heartbreaking for individuals who want to connect. And scent therapy is a way and a tool that a family member can reach and start something new and feel that they're helping in the care of the loved ones. I go to the long-term care homes quite frequently. And when I'm there, I see the same thing. How are you, Mom? How are things? How is lunch? It's hard to create new memories when it's a challenging environment, and it's an environment that is not necessarily supportive of the family per se, because it is designed for the patient. And so scent therapy is a tool where we have seen some incredible interactions. I have an individual, for example, who has a lot of challenges with eating, and the husband comes in and does the scent therapy application prior, and the food experience and the dining experience has improved 100%. There's many examples along the way. So as we smell about 10,000 different smells every single day, we are experiencing those smells at a low threshold. What we do with our work is we utilize a paper scent stick, which looks like this. They're disposable, safe, easy to hold, and we incorporate it with specific essential oils or certain scents, and you're smelling. This is not diffusion, this is not aromatherapy, and so what we focus on is helping the homes if there is a need of a scent-friendly policy, because many homes say that they ban scent. And that may be true for scent sensitivities, but smell is based on a vibration. That's how it enters the nose. It's like music. An allergen is not located within a scent molecule. And we know there is no allergic response to scent. What we know is there's a scent sensitivity. So understanding that policy, understanding how that is presented is very important. And so my goal is to help the homes come up to speed, may I say, with understanding. Some have determined a good smell and a bad smell. Is detergent a good smell or a bad smell? What does fresh, clean clothes when they come out of the washing machine, is that a good smell or is that a bad smell? It's very difficult if your scent policies are not really in tuned. I've come into some homes and hospitals and they say no fragrance. Well, fragrance means a lot. It's a non-accurate word for a whole bunch of things. And what they really want to say is alcohol, solvents, and phosphates. And so I am more than willing to help. I have a video on YouTube. I also offer a webinar. And so if you are talking to the home of your loved one and they push back with a scent-free policy, I will gladly help them get up to occupational standards right now and help them update that policy. And the reason for it is because there's a problem when scent is not integrated within health. 78.4%, and that number changes depending on the homes that we're visiting, have poor to no sense of smell. This impacts appetite, anxiety, sleep, and the emotions of your loved ones. And so by not identifying this right from the beginning, and it is not done in the intake process. And if you remember the intake process, you sat down, answered a whole bunch of questions, filled out a bunch of forms, and you were admitted. And the conversation was, well, tell me a little bit about your loved one. But no one actually did an evaluation. Can they smell? And if you can't smell, you can't taste. And if you can't taste, you're generally going to have some problems with the food that you're eating. It's going to have an impact on anxiety, and it is going to have an impact on your emotions and sleep. And so if that conversation is not actually addressed right from the intake process, you as the family member, as well as the loved one who is supporting your individual in the home, you don't know. And they may be talking about appetite, and it could be as simple as the individual can't smell the food, they're not interested in eating. And so all of these things come into play. And so we like to address that right from the beginning. The solution is we offer a scent therapy program. And the program is designed that it is not aromatherapy. We teach a web-based training program that is educational, that we work with the PSWs, rec therapists, nurses, and we incorporate this program in their day-to-day recreational programming, but also to help individuals with one-on-one. We focus on scent, we focus on smell, we focus on the research associated to certain scents. We know, for example, rosemary is a great example, has a high level of camphor in it, And we know that rosemary helps to stimulate areas of the brain and the frontal cortex of individuals who have lost their sense of smell because of dementia and Parkinson's and Alzheimer's. By stimulating that sense of smell in the brain helps to stimulate neurons. By smelling 15 minutes of various different scents on a daily basis, even for yourself, it is similar to an hour's worth of chess game. From a cognition standpoint, the research is quite compelling. By using scent at night, you increase your memory by 234%. And that is a simple engagement process for memory health and cognition. And there is lots and lots of information, research support that talks about how to keep your mind sharp, how to keep it active. It's not just playing Scrabble and crossword puzzles. There's other ways to incorporate it. And scent, specifically smell therapy, is a fantastic tool. We have a best practices where, generally speaking, individuals who can't smell, it takes about 7 interactions before we see a shift and we start to see people engaging within scent therapy. And so the best practice process takes time. Some people can smell right away. Some people have a less sense of smell in certain areas. There's 4 major areas in the brain, like in tasting, for specific scents. And some people can smell citrus, for example, but they can't smell floral. Or the floral smells like skunk, and it doesn't have the same acuteness as an individual who can detect it. So what we like to look at, and it's just simple identification, first of all, and there's a grid system of 1 to 5. It gives you a score, and that score you can monitor. So it's an easy process, but it's also, it's an important process that we overlook. One of the things that we're seeing as in some of the homes that we're dealing with, and these are some of the homes that we're focusing with, isolation, and they have the full scent therapy programs in their toolbox, may I say. We have anxiety, sadness, and loneliness. And after 15 minutes of those individuals doing a session of scent therapy, the anxiety changed to a 48% increase feeling happy. 44.4% felt calmer, and 24.4% felt that shouldn't be confronted, my error, that should be comforted. That's a spelling, I'm sorry. It's important to understand the emotional impact of the person is emotional-based care, and that is what I'm focused on. There are many types of care within a home. There are many different programs. My focus is to ensure that when we work with the Region of Peel and their out-day patient program, that we are giving tools to enhance certain rec programs. We're focusing on sleep, that 90.9% feel more relaxed when they do 15 minutes of scent therapy prior. 72.7% of the individuals we work with feel comforted, and 63.6% feel calmer. Some homes do use a diffuser in a private room, and I have loved ones who buy a diffuser and put it in their home, in their loved one's room. And if they're sharing a room, it sometimes becomes a problem, but if they're not, it is sometimes a fantastic tool to assist with sleeping, because we know when someone is disrupted in sleep, one of the issues that happens is they get out of bed, and that's where falls occur. We also know lavender doesn't work with dementia patients and Alzheimer's. What we see is limonene, which is a raw material found in certain citrus notes that actually calms the brain down. And so the perception of what people think is aromatherapy from an Alzheimer's, dementia, and research perspective on how it impacts sensory stimulation, there is a big difference. So we're focused on helping individuals sleep longer and wake less. Appetite stimulation is a big part of the programming that we're working with. Responsive care right now in their homes is looking at a pilot project. We have done some work in particular with Kindred Living, and we saw 30%, we saw overall them adapt scent therapy because there was a national report that came out talking about a 30% increase in supplements, and individuals having appetite stimulation in Canada. That was alarming because for me, I know that the kitchens are not within the area. People are in the rooms or in a program, they can't smell the food. And scent is a big trigger that it's time to eat. And smelling food turns on the appetite stimulation, it increases the digestive juices, and it encourages it's time to eat. Dogs are a fantastic opportunity because a lot of it is based on timing, but they can smell and know that there is a time for them to have their dinner, and they're usually clockwork. Applications of smell therapy conducted prior, we have seen, and we have many of these in process right now, 30 minutes prior to mealtime for 15 minutes of 2 to 3 specific scents prior to a meal has increased intake of eating by 76%. And we've had, in one particular case, only one refusal. Well, she just didn't want to eat. But the majority of time, we have 100% engagement. Individuals are interested and they are willing to smell. It's interesting to them. It's something very different. And also you or the PSW or the family member or the support team that is working, it smells good. It feels good. It's a good activity. There's a reward. Reawakening your sense of smell. Residents with little or no olfactory can begin identifying scents just after 7 sessions. So there's a success rate. We stimulate dormant neutral pathways linked to memory and emotion. We know when you have lost your sense of smell, you can get it back. But the only way you get your sense of smell, which impacts your sense of taste, is by smelling. And if you don't do it, you will not increase your sense of smell. That's why chefs, sommeliers, connoisseurs of flavors and smells, they smell and their taste buds usually are aligned. There's a cognitive engagement process where it supports memory recall. It encourages storytelling and personal connection, and it creates new storytelling, which is really important. It enhances participation. And this was a wonderful quote that was given by Caroline at the Champlain Long-Term Care. She could not get anybody to participate in exercise classes. And we incorporated the scent therapy prior. And 15 minutes, we trained the staff to pass around the scent stick specifically for stimulation, that this was going to be yoga class or whatever exercise program. In the home, in the area where the recreation class was, they had a diffuser going, or sometimes they passed around the individual scent. I'm so sorry if you can hear that tapping. There is some construction going on. I apologize. The scent was then passed around to individuals, and those individuals then smelt it prior to going to exercise. What ended up happening is they asked for more yoga and exercise classing. And it was just a change of an adjustment of approaching exercise in a different way. Emotional regulation, up to 65% reduction in anxiety and agitation. And sometimes we see with Alzheimer's and dementia patients, they get agitated very quickly, and you need to calm them down. The one thing about scent is it is an immediate way of triggering the brain to a new response. It creates a calmer environment, and it helps to reduce interventions. We have seen a decrease of psychotic medications, depression medications by 30% in some homes because they're incorporating alternative approaches first prior to getting into that space where the anxiety has become more and more predominant. There's an improvement of social connection because scent is scent memories. It's conversation. We utilize a really cool kit. We provide 20 specific scents. We have programming. We teach how to incorporate this programming. And it becomes a wonderful tool that we add on to other program. And this is how you get sensory stimulation therapy, which is a new program. All because you're incorporating scent with another form of sensory stimulation. Better sleep, better appetite, because it enhances natural circadian support and reduces sundowning and restlessness. All of this is available through in Ontario with the funding. And this is something that I always challenge with. The long-term care home gets funding for programs like scent therapy. They often use that for something else. So the budget is coming up in January 1st. We are a part of the behavioral support system. We help residents response behavioral program. We are one of those tools that is fully funded by the Ontario government. It's just the home has to adopt it. So we work with the Ontario Long-Term Care, Advantage Ontario, the Alzheimer's Society, various different groups, and I have lots of information. And if you feel that you want to introduce this to your home and that they need support or information, I'm here to support them. But for you, there is lots of information. If you go to my website of Smelling Pink, there is a subscription where we send out a newsletter, and those newsletters have updated research. If we do a webinar like today, we put that on our newsletter. We're in the olfactive group on LinkedIn where we publish papers from all over the world. And I have been doing this since 2012, and I have an incredible support system internationally, from Germany to Spain to France, of some of the top researchers sharing their data and research with us. And this is also very helpful because this has allowed us to expand and allow people to see what is really happening. We're obviously on social media, and I am here to help you. We have an online store if individuals are interested. We have an intake kit. We have various different raw materials. We also have diffusers, and we can help families if they want to do this individually, or if you want to support it through the long-term care home. My name is Tracy Pepe. I want to say thank you. I am going to put this back to the Ontario Family Council so we have an opportunity to answer your questions and have a conversation about anything that you would like. Just waiting. I think I have to go.
Thank
There
you,
he is.
Tracy. Yes,
Hi.
I'm just checking to see if we have any questions coming in. Thank you so much for this presentation. So I will give just a little bit of time for our participants. If you have any questions, you can put them in the Q&A box. You can also put them in the chat. Yeah, we are here to discuss.
One of the questions that has come up with me for my sister is how does scent therapy work when my sister has other ailments? She is schizophrenic bipolar, and how does this work with her? And one of the things with my sister is sometimes she gets very anxious, and for example, she'll want to go and watch the Blue Jay game. And if the Blue Jay game is not on at a certain time in the lobby, or someone is watching something else, she gets very anxious. And my sister can be quite aggressive and verbally. And knowing that, we have been in situations where we have chosen certain scents that help to release certain hormones that will help calm her down, and say to her, Linda, be patient, sit and smell the scents and deep breathe and relax, and your turn will come up soon. And Linda knows how to regulate based on that. And that is a really interesting self-development because regulation with individuals with certain mental health issues, that's a challenge. And so sometimes we have diagnoses, but those diagnoses are compounded with a whole bunch of other things. It's never cookie cutter. And part of the work that I do is I get the recreational calendars that come in from different homes. I have one sitting in the back, and I show them ways to integrate this into already current existing programming so that they enhance the quality of the care they are giving versus just a bingo night. We do a sensory stimulation, could be something as simple as coffee time. Coffee time in one home was not a successful program. They tried to offer coffee and get people to stimulate and have a conversation, and nobody, everyone would take their coffee back to the room. And so I incorporated a pairing game where we had the smell of vanilla, we had the smell of spice, chocolate, and cake. And those smells were put in cups. And as the individual got their coffee, we would encourage them to smell something and drink their coffee to see if they could have an engagement. And it was fascinating because this turned into something completely different. And everybody started talking, and now coffee time takes an hour and a half. It's no longer grab your coffee and go, which sets the stage for the next program because people are already engaged. And that's what they were looking for. And so I am here to provide as many tools as possible to help individuals with their long-term care homes.
Thank you so much for sharing that, Tracy. I don't see any questions coming in right now. So what we can do is, if you have any questions and if you are, watching this online and if you have any questions, you are welcome to either email me or you can connect with Tracy on the Smelling Pink website. And we can follow up with answers. And as Tracy mentioned, Tracy is available to present all of this topic at your family council meetings. So please feel free to connect with us. Tracy, do you have any final things you would like to share with our audience?
No, I just want to say thank you to each and everybody. Sometimes we have contests. We have a contest right now where we're giving away a scent intake kit. So my website has some fun stuff. We try not to commercialize it, and we really try to focus on the research and the work. But I also try to provide tools because I know people, where do you start? What do you do? How do you do this? And I'm here to assist anybody and everybody. And I just hope that people walk away from today's webinar thinking, I never thought about scent, and that's okay. And now that you can, what do you do?
Thank you so much, Tracy. And please feel free to share this webinar. And if you haven't done so, you can subscribe to Family Council's Ontario Weekly e-Bulletin, which is where we will announce when this webinar will be live. And yes, thank you so much for being with us today. Thank you so much, Tracy, for your presentation. And I look forward to seeing all of you at our next Family Council's Ontario webinar. Thank you so much, everyone. Have a great day.
Thank you.
Goodbye.
Bye.